thank you for having me. I really appreciate being here. And today I will be representing as the Executive Committee member for South Africa for the Global Mental Health Peer Network. So in terms of, I just want to make sure, am I clicking next or? Well, okay, okay, next slide, please. So I wanted to just give you a brief overview of my presentation. I will briefly discuss who Global Mental Health Peer Network is, what was our response to COVID-19, the effect of COVID-19 on the elderly, the effect of COVID-19 on mental health. I'll give you 2 country examples of some supportive care and some well-being recommendations. Next slide, please.
Mansi, could you scroll down, please, the slide?
Hi, yes, there we go. Thank you. Also, the Global Mental Health Peer Network is a platform that was developed by the founder, Charlene Sunkel, and it's a virtual network of individuals and organizations that has global secretariats in Australia, India, and South Africa. And this Foundation for Global Mental Health Peer Network was launched in 2018. And it really was to create an extensive and globally diverse mental health community and create leadership within people with lived experience. And in particular, our focus is to create human rights-based practices across different societies and also in different practices. The Global Mental Health Peer Network's core business is to expand its global footprint and ensure global diverse representations of persons with lived experience, to continue to empower the lived experience community by improving mental health and human rights literacy, and develop global mental health lived experience leadership, and which will also influence policy and practice to transform mental health care and services. The Global Mental Health Peer Network is a non-profit organization whose executive committee members includes individuals representing from different countries, 31 countries at the moment, and different professions, including academic professionals, medical professionals, professionals from NGOs, business, and social enterprises. Next slide, please. So the Global Mental Health Peer Network had created a response to COVID-19, and we created a dedicated space on our website, which included a position statement from the perspectives of people with lived experience, information and articles on well-being during the pandemic, and in particular, linked to those with lived experience and mental illness. We've also included video messages and statements from the members, and our focus really is on peer supportive tools. Next slide, please. So these reports, I am certain that most are aware of these reports. I don't think any of us are shocked by this. So essentially, these two cases really focused and shed light on the fact that elderly has been neglected severely, and that there's also been a great increase in inhumane treatment of the elderly population. And the first case was really in Spain, and where the elderly was found abandoned in care homes, and while they were doing the disinfectant procedures, and people who were, or their caregivers were leaving them to their own fate with no alternative measures of care when they left. The second case was a case in Budapest, and it indicated ambulances near an elderly care home where 5 people were reportedly died and 100 more were infected by coronavirus. And a lot of this is also due to the limited access to PPE. And there was a particular criminal case that was opened in South Africa recently against the head of department in KwaZulu-Natal. And it was really because of the lack of PPE that was provided to staff in care homes. And that's, again, another issue that contributes to the increase of COVID with elderly people. Next slide, please. So the effect of COVID-19 is understandably immense. There was a rapid review evidence paper by The Lancet that was published on the 26th of February about the psychological impact of quarantine and how to reduce it. And it revealed widespread concerns about the effect of social isolation or social distancing on well-being. And it also emphasized the increase in anxiety, depression, stress, and other negative feelings, and the concern about the practical implications of the pandemic response, including financial difficulties. The prospect of becoming physically unwell, unranked mental health support and services under pandemic conditions, and the effect of COVID-19 on mental health of family members, especially children and older people. There was also another paper published by The Lancet on the 15th of April on multidisciplinary research priorities for COVID pandemic, a call for action on mental health science. And it revealed a review of 24 studies documenting the psychological impact of quarantine. And in short, people who were quarantined are very likely to develop a wide range of symptoms of psychological stress and disorder, including low mood, insomnia, stress, anxiety, anger, irritability, emotional exhaustion, depression, and post-traumatic stress symptoms. They emphasize the need for research to address how mental health consequences for vulnerable groups can be mitigated under pandemic conditions, and the impact of repeated media consumption and health messaging around COVID-19. Next slide, please. Further to that, the Interagency Standing Committee noted some common responses to COVID-19 that is relevant to the elderly. It is fear of falling ill and dying, avoiding approaching health facilities due to this fear, a fear of losing livelihoods and financial means, a fear of being socially excluded and placed in quarantine because of being associated with the disease, feeling powerless, feeling a fear of being separated from loved ones, a refusal to care or unaccompanied or separated minors, people with disabilities, or the elderly due to fear of infection, feelings of helplessness, boredom, loneliness, and depression, a fear of
reliving the experience of a previous epidemic, and the risk of deterioration of physical and mental health of vulnerable individuals. Next slide, please. Additionally, there was a recent editorial published on the 21st of March, and it's focused on COVID-19, mental health and aging, and again emphasized the need for new knowledge to bridge science and service. It highlighted COVID-19 as a new and rapidly evolving crisis with little knowledge about the broader impact of mental health. Clinicians are gaining early experiences around a range of issues that are highly relevant to mental health care of older persons in the context of COVID-19. As one of the panelists mentioned earlier, retrospective studies on the 2013 SARS pandemic found that rates of suicide among older adults spiked during the period of the pandemic. This finding echoes the above-mentioned Lancet publication, again, which highlights the urgency for studying mental health impact of COVID-19 in real time. Next slide. To address some of these issues, I'm sharing with you two examples of promoting well-being of elderly, one in South Africa and another in Japan. The CARE project was recently launched in Durban by non-profit organization South Africa, by the South African Depression and Anxiety Group in response to the COVID-19 and the increased support needed from the elderly population. Their main aim was to facilitate support for aged in residential homes during the COVID pandemic and to help decrease some of the negative effects of lockdown and social distancing, to provide relevant, useful information to residents regarding the outbreak. And some of the impactful elements here is the sharing of ideas around activities that might take away some boredom, by finding ways to stay in touch through voice call or by sharing uplifting, inspiring, fun messages with residents, offering basic WhatsApp and messaging training, and creating support groups where possible. This project will have an ongoing evaluation over the coming months. Next slide, please. A very powerful storytelling platform is a project called In My World, and it's a documentary photo activism stories by an organization called Witness Change. In this photo series, they explored experiences of elderly people living with dementia in Hokkaido in Japan. This particular story focused on Tokasha, who provides services to people with special needs and isolated elderly people in Japan. Their group homes, established in 2017 and 2008, respectively, are homes to 36 people with dementia. So these homes provide a living situation that function as small communities with limited number of people. Specifically here, the food and general care is provided, but there's an emphasis on maintaining the individuality of each person. They are encouraged to do tasks that they have capacity to perform, and they're involved in activities such as gardening, preparing meals, shopping for food, and cleaning their homes. Japan has a nationwide investment in elderly care that created facilities where those with dementia can contribute to their community and regain their identity. For many, as they find themselves valued for who they are and who they were, their quality of life improves, and so does their health. Next slide, please. So I'd like to conclude my presentation by presenting some recommendations on well-being. the previous speakers have very meticulously noted some of the general well-being factors, and those are physical exercise, breathing techniques and mindfulness, adequate sleep, healthy balanced meals and diets, and avoiding alcohol, recreational drugs, or toxins, and more. But what I would like to focus on today is 3 factors that greatly assist in addressing well-being, and that is hope, purpose, and peer support. In terms of hope, the Virginia Commonwealth University Professor Everett Worthington is an author of the new study that sheds light on the role of hope in improving the lives of an aging population. For older adults, hope can be the key piece for improving health, psychological, and social well-being. Hope is both emotional and behavioral, and it's having an expectation that is both desired and possible. Whatever we hope for must be positive and must have behavioral actions that we can step to get towards. And if we can't get there, we need to be able to pivot. It incorporates deeper concepts, including passion and purpose, growth, mindset, kindness, gratitude, presence, empathy, sacredness, collaboration, self-efficiency, creativity, belief, and more. Dr. Anthony Scioli explains hope. There are 4 kinds of hope, and also promotes it as something that can be taught like a muscle, like training a muscle. These 4 elements are attachment hope, mastery hope, and survival hope, and spiritual hope. All of these factors have different implications, and all of these hope elements creates a holistic view on, or a holistic purpose for an individual. In terms of purpose, the Human Flourishing Program at Harvard Institute of Quantitative Social Science at many topics that are fundamental on human well-being, such as happiness itself, virtue, ritual, community, meaning, and purpose, that have traditionally been viewed as principally falling within the purview of the humanities, often of philosophy or theology. Meaning is now widely recognized as essential to human well-being, and numerous studies have documented the association between perceived meaningfulness and a host of improved psychological benefits. Baumeister has argued that a meaningful life may be compatible in significant ways with being unhappy, but a happy life is impossible without meaning. Peer support. A pilot design research has been conducted on peer-to-peer support model to improve the quality of life among highly vulnerable community and older adults in Cape Town, South Africa. This program has demonstrated improvement in client well-being and social support in low-income communities. Older persons familiar with the challenges faced by the elderly are well suited to identifying and responding to the needs of older persons, and providing social support to prevent loneliness and depression. At the Global Mental Health Peer Network, we have also seen the increased benefit and value of being part of a peer community, creating a safe space where you are able to share experiences without fear or prejudice. Asking, "Are you okay?" can reduce the weight of how somebody responds. Next question. Next slide, sorry. I will leave you with a few resources and links to resources, and I'm happy to share any of them on request. That is me. Thank you very much.